Hello, I'm Dr. Roy Picard. If you are having a problem with an underactive thyroid gland, then chances are that you are suffering with one or more of the following symptoms: fatigue, morning headaches that reduce as the day progresses, you get plenty of sleep but you still feel tired all of the time, cold hands or cold feet, you get constipated or require some type of laxative on a regular basis, lack of motivation, hair falling out, mental sluggishness, perhaps brain fog. You may notice that your hair is brittle or it's getting thin. You may have dry skin. Perhaps there's loss of the outer one-third of your eyebrows. You may suffer with depression or have difficulty losing weight. Now, if your thyroid gland is overactive, then common symptoms would include such things as the inability to gain weight, anxiety, nervousness, night sweats. You may feel your heart racing at times. You may notice inward trembling or possibly even insomnia. Now, the good news is this: no matter what you've been told, no matter who you have been talking to in the past, I'm telling you now that you do have an opportunity to turn things around. Now, my degree is in chiropractic, but what I utilize in my office is chiropractic neurology, functional endocrinology, nutrition, brain-based therapies, and much more. This is what allows me to get results where others have failed. Why have others failed you? It's actually quite simple. Traditional medicine is behind the times when it comes to helping those people who have thyroid symptoms. They primarily will address 2 or 3 types of thyroid patterns of dysfunction when it comes to dealing with thyroid patients. Now, in the past few years, it's been uncovered that there are actually many different patterns of thyroid dysfunction involved. Unfortunately, traditional medicine has been too slow to address this issue, and you, along with millions of others, are needlessly suffering as a result. Now, most often when someone has complaints related to a problem with the thyroid, the traditional medical approach is to look at a person's TSH and T4 levels. Now, right off the bat, there's a problem with this because there's so much more that needs to be looked at to uncover which of the many different patterns of thyroid dysfunction are involved. Now, for the thyroid specifically, you should also be including such tests as the total T3, free T3, total T4, free T4, the reverse T3, T3 uptake, thyroid antibodies, and much more. You have to understand that each of these patterns that I'm referring to, well, they have their own separate solution. Without the right tests, you can't really determine the correct pattern of thyroid dysfunction. Now, this is why it is so common that a person with thyroid symptoms goes to either their primary doctor or an endocrinologist and doesn't get any better. They get tested and then they're told that there is nothing wrong, or they are told that they have a thyroid problem, and then they're given things like Synthroid, levothyroxine, Levoxyl, Armour, levothyroid, Nature-Throid, but their symptoms still end up remaining. Now, all of those different drugs are pretty much geared to only addressing only one of the different patterns. So unless you are one of the lucky few who just happens to have that particular pattern, you're really not going to get your problems dealt with, and you'll not get the results that you deserve, and then you will be left with dealing with the symptoms of thyroid problems for the rest of your life. Now, if you have an underactive thyroid gland, you'll end up trying every type of fad diet and weight program just to lose weight, and your weight, well, it might shift a little bit here and there, but eventually the weight comes back and you will get so frustrated that you'll just end up quitting. Now, for many people, it makes them feel guilty. They often hear from others that, well, you just don't have any willpower when it comes to dieting and exercising. Look, if you have a problem with your thyroid that has not been properly addressed, you can exercise and diet all you want, but the bottom line is that the thyroid problem is not being addressed, and sooner or later, you will end up right where you started. Now, as I mentioned in the beginning, that depression is very common with a thyroid problem. Do you have any idea how many people are taking mood disorder drugs because of their unresolved thyroid problem? Most people with thyroid symptoms, they just get so frustrated and they end up quitting and giving up, expecting to live the rest of their life in misery. And I'm telling you that it doesn't have to be this way. You can put an end to your suffering as long as you get the right types of tests, the right types of analysis, and of course the right types of care. Now, if you have an overactive thyroid gland, then chances are that your thyroid gland will be removed or eventually destroyed, which will then make you become underactive thyroid patient. If you are looking to get more information regarding what you can do to get rid of your thyroid symptoms, then I'm recommending that you call my office for a $27 screening. During the screening, I'll go over your history with you. I'll review any previous blood tests that you have using a functional approach, which is pretty much different than a traditional type of analysis. And I'll perform a set of non-invasive tests, basically to determine what is the best course of action for you to take. This screening, along with the information that you supply me with, will be used to tell you what tests are specifically recommended, what care is best suited for you, what other options are available, as well as the cost of the care. So if you're looking for answers that will help you get your life back in order, then be sure to call my office and my staff will be happy to schedule this $27 screening for you. Again, I'm Dr. Roy Picard, and I wish you nothing but the very best.